If you'd like to add at least 7 extra new patients to your dental practice each and every month without spending a dime and for 0 extra effort, you're in the right place, because that's exactly what we're going to do, and we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
If you're a solo doc, you're likely seeing between 30 and 50 new patients a month. If you have more than one doctor in your practice, then follow along and do the math for your practice. Let's pick a number in the middle. Let's say you're seeing 40 new patients a month. Roughly what percentage of your new patients are accepting your recommendations for care and returning for ongoing care? As a solo doc, if you're getting 90% case acceptance and new patient retention, and you're doing at least $1.8 million a year, you're a rock star. And you probably don't need the gem that I'm about to share, but let's say you're a mortal, normal doctor, and out of 40 new patients per month, 25 to 30 of them move forward with the treatment and stay with your practice for ongoing care. Out of the 10 or 15 new patients each month who never return, it's easy to turn 5 to 7 of those into happy raving fan patients who'll stay, pay, and refer. You can do this starting tomorrow. Just follow my 3 rules for maximum new patient retention. This strategy is for use with the asymptomatic new patient, Jim, who says, "Hey doc, I think everything is just fine. I just need a cleaning and a checkup." It's not for Mary, who needs or wants implants or crowns or veneers, and she was referred by Mrs. Johnson, your raving fan patient for whom you completed a $40,000 spectacular reconstruction. We were never taught to differentiate between Mary and Jim. Mary may not know you, but she knows what she needs or wants, and you come highly recommended. The likelihood of her accepting and moving forward with the care you recommend is very high. For you not to recommend the very best possible dentistry would be shortchanging the patient and your practice. Contrast that with Jim, your new patient who found you online, has no symptoms, and he assumes that everything is just fine. Meanwhile, first glance into his mouth and you see a bunch of 30-year-old amalgams, wide open margins, similar to the kind that, when you take them out, you find caries underneath. Tell Jim that he needs $20,000 worth of posterior reconstruction, and the odds are you will never see him again. Why? Well, it's simple. Because Jim doesn't know you, and he has no reason to trust you. At least not yet. Maybe he's old enough to remember the Reader's Digest hack job that labeled all of us dentists as thieves. Or perhaps he watched that episode on 60 Minutes where they did the exact same thing. After all, Jim has no symptoms, nothing's broken, and his last dentist said, "Hey Jim, everything's just fine." According to Mercedes-Benz, it takes 6 positive interactions with a new customer, client, or patient before they're ready and they're comfortable pulling big money out of their wallet and handing it over to you. Those 6 interactions give you both time to build relationship, and with relationship comes trust. Follow my 3 rules for the asymptomatic new patient. You'll not only retain a lot more of your new patients, but in time you'll have the opportunity, the chance to present very best possible care and greatly improve the odds that your new patients will accept your recommendations. Devil's advocate. What if this gem only helped you to retain 5 extra new patients per month? That's 60 per year times $4,800 average lifetime value of a new patient in a general dental practice. 60 new patients per year times $4,800, that's just shy of $300,000. Now granted, that's over a 6-year period, which is the average stay of a new patient in a general dental practice. But with this strategy, each and every year you'll get 60 additional extra new patients, and that means by year 2 or 3 and beyond, you'll enjoy several $100,000 annual increase. Patients who used to run out your back door. Let's take a look at the 3 rules for the asymptomatic, I think everything's just fine, new patient. New patient rule number 3, don't hurt them. What's that? Are you suggesting that it's okay to hurt a long-term patient? No, not at all. You and I agree that it's imperative that you do everything you can to keep all of your patients comfortable, new and long-term. But here's the thing. Every once in a while, there's going to be an injection that stings. There's going to be a tooth that you thought was numb, and really it wasn't profoundly numb. And although nobody wants to hurt any patient, most of your long-term patients are going to cut you some slack, at least once, maybe a couple times. But give a painful injection, or drill deep into a tooth that's not numb on a new patient, they're far less likely to forgive you and far less likely to come back. In a moment, 2 more rules to ensure your new patients come back again and again. But first, let's take a quick look at the effect on your net profit, your income, when you reduce your overhead by 10%. Let's say your overhead is 70% of collections, and you're keeping 30 cents on the dollar. If you reduce your overhead from 70 down to 60%, that extra 10 cents that you're keeping on every dollar, that represents 33% increase in your income. What if your overhead were 80%? Well, you're keeping 20 cents on the dollar, so reducing overhead from 80% to 70%, keeping just 1 extra dime for every dollar collected, that means a 50% increase in your profit. Whether you're watching this during a global recession or during a financial boom, you'll take home more profit after you read my free report, 4 Ways to Get Your Overhead Under Control and Boost Your Net Income. Less than a 10-minute read. Get your free report at freegem1.com. That's freegem and then the numeral 1. freegem1.com. There's a link in the description below. New patient rule number 2. Don't take much of their time. You want to consistently retain way more of your new patients? Walk in their shoes and get inside their heads. Understand their expectations. Again, to be clear, this is not for the new patient who is referred by a raving fan, the new patient who tells you that she knows that she needs a lot of work and she's finally ready, willing, and able financially to proceed with the care. Rule number 2, don't take much of their time. That's for the asymptomatic new patient who thinks everything's just fine. So how much time? Well, for the new patient visit, get them in and out in less than an hour. As for the initial treatment plan, limit that to no more than 2 or 3 visits. If you're finding this helpful, I'd appreciate if you could share this video with just one other dentist, and it would be amazing if you could click the like button. That way I'll know to do more videos just like this one. New patient rule number 3, don't take much of their money. Now, there's no exact amount of money that your new asymptomatic patient's going to be comfortable with, but as a general rule, if their out-of-pocket portion is, let's say, more than $1,000, it's too much. Now wait, you may be thinking, Tom, I've had plenty of brand new asymptomatic patients and they accepted way more than that right off the bat. No doubt, I'm sure you did. But the purpose of this shift in mindset is to help you help more of your new patients become happy, raving fan long-term patients. You'll be better able to serve more patients at the highest level, delivering your very best care. The result? You'll have more fun and you'll make way more money. Now you can see how this gem will help you retain more of your new patients, but it also raises a whole new set of questions. Not the least of which is, how is it possibly ethical or even credible to allow your asymptomatic new patients to walk out thinking that everything's just fine when you can see that it's not? The answer is it's not ethical, it's not credible, and I'm not suggesting that you do that. It's beyond the scope of this video, but in our next video, I'll cover exactly what to say and exactly when to say it, to ensure that you're telling them the truth and you're laying the foundation, you're building a long-term relationship while still following my 3 rules for the new patient. Don't miss the next video, how to convert more of your new patients into lifetime raving fans. Question, do you have a gem that you use to increase new patient retention? If so, let me know in the comments below. I read and respond to every comment personally. Remember, you're only 1 gem away